Hi, we're here with Mr. Michael Puttick, who's a consultant general surgeon who specialises in breast surgery, and he's been working as a consultant in general surgery at the Stoke Mandeville Hospital for the last 2 years. But he's been training in surgery for the last 17 years, and he's trained in many of the units in the UK, but also he's gone as far afield as Auckland, where he was training there for a whole year doing a fellowship in oncoplastic and breast reconstruction surgery. So I'm really pleased to talk to Michael today. How are you, Michael?
I'm very well. How are you?
I'm fine, thank you. So Michael, I thought it would be really interesting to hear what advice you might give to someone who, might just incidentally have found a breast lump, maybe just on self-examination, maybe in the shower or whilst changing, because that can be quite a scary thing to feel. And I was just wondering, with your expertise, whether you might be able to give us a little bit of advice as to what we should do.
You're right. I think finding a breast lump is a scary symptom for anyone. And partly because there is happily quite good public awareness about breast cancer and what that involves. Very simply, the advice I would give is to get it checked out. I say to people who come and see me, I say the two questions with a breast lump is, what is it, and do we need to do anything about it? So although sometimes they can be associated with other symptoms such as pain or changes to the skin or changes around the nipple or not, actually a lot of people who do have a breast cancer feel completely well. They don't get any symptoms from the lump, and as you say, it's sometimes just a little finding they find incidentally just while washing or going about their daily business. So the simple advice really is, do get it checked out. Happily, most lumps that people present with in clinics are benign. They're not cancerous, and they don't necessarily need anything doing. So while the majority of lumps actually are nothing to worry about, you don't know that unless you get it evaluated.
Right, okay. And we hear a lot in the press about these kind of genes that help to kind of predict whether you've got breast cancer or not. Is it worth knowing your genetic risk? Is that something that we should be doing?
I think people who've got a family history, actually, if you've got family members who've got breast cancer, you are worried, and it does perhaps make you more aware of symptoms that you get. It's only a small percentage of breast cancers that are actually associated with these genes, and the genes do get quite a high profile, such as with the recent case with Angelina Jolie having a bilateral mastectomy. But having a family history can put you at slightly increased risk of developing breast cancer, although sadly it is the most common cause of cancer among females. If you're concerned at all, you could see your GP or get referred to a specialist and actually talk through what the actual risks are. Most ladies in this country are offered breast screening, and if it's felt that you are at more increased risk than the next lady, then it would be appropriate to get a screening program tailored specifically for you.
Okay, so if you've got a family history, you can maybe go to your GP and maybe see a specialist. But if you haven't got a family history, you wouldn't know what your risk is. And if you find a breast lump, as you say, the best thing to do is to get it checked out. So what advice would you give someone on how to get their breast lump checked out? What should they do?
I think there's many ways of finding the right person to see. A lot of people you can start with your own GP. They may examine you themselves and feel confident enough to make an assessment and either reassure you or refer you on. Most GPs will know a good breast specialist in their area, and they will be able to refer you on in a timely manner. You may also have recommendations of friends. I would say if you're trying to find a breast specialist, most breast specialists are labelled as breast surgeons, or they do a lot of work in clinic doing diagnostics and advice. Most have got a background training in general surgery. Within that, they will have sub-specialised into breast surgery, and a breast specialist in this country will usually be a member of the Association of Breast Surgery, which is our own specialist association.
Okay, so that's some really good things to look out for if you were searching online for someone. And just tell me, Michael, if someone were to come to you, what would they expect to get, after they've phoned you up or contacted you?
I usually try and see you as soon as I can. I realise that around breast things there is a lot of anxiety, and you want to get things sorted out for yourself as quickly as possible. What I do for you is arrange a clinic appointment in the outpatient clinic, And during that, I would ask you some questions first of all, and that would be about your family background, your general health, some other things of interest around the breast disease actually pertain to whether you've taken the oral contraceptive pill, been on hormone replacement therapy, the number of children you might have had. And then we'd move on perhaps to the symptoms that you've got, and I'd ask when you've noticed the lump, if it's a lump, whether it's hurting you, and any other symptoms you may have, such as changes around the skin, particularly on the nipple, any nipple discharge, any swellings in the armpits, or something like that. After that, I'd then examine you and look at the lump and assess what we're actually dealing with. And based on the findings from our discussions and examination, I then recommend for you what we need to do next. And that may be some imaging investigations or scans, such as a mammogram or an ultrasound scan. And I'd also make a recommendation whether you needed to have a biopsy done. Most of the clinics, we have radiologists on site who are specialist consultants in breast disease, and they can usually do your scans and mammograms on the same day and give you a report on the same day, because we realise just how anxious the whole process can be. If at all possible, we'll also try and take the biopsy. Sometimes the biopsies can be read the same day, but what I usually do is we sit and we would agree on when we'd get the results back and whether you'd come back to a clinic appointment the following week, or whether the results are something we could perhaps discuss on the telephone within a few days.
Gosh, that's really quick then. So you'll see them quickly and you'll get all the tests done and reported also very quickly, either that day or maybe a day or two later. So that's fantastic.
Well, I think that's what you want.
Yes.
To get the answer.
And like you say, you need to find out what it is and what you should do about it. So hopefully it will be, what you call a benign problem, which, it's not a cancer. And so presumably then there'll be nothing to do for it. But if it were to be something like a breast cancer, what would you do after that point?
If it were something like a cancer, then what we aim for people now is to say, rather than you are a patient with breast cancer and this is what you need, is try and tailor your treatment to your cancer. I work as part of a multidisciplinary team, so I work with oncologists who specialise in the giving of chemotherapy, some who deal with radiotherapy. We deal with specialist pathologists who can advise us on the tumour type and how it might behave and what it might be the most effective treatments for it. And for some cases I work in conjunction with plastic surgeons as well, because if, for example, you need a mastectomy, you may also want to have a reconstruction, which we can sometimes do at the same time. And the plastic surgeons I work with, again, specialise in breast reconstruction, so they can advise on whether they're going to use tissue transfer, moving some skin and muscle around the body, or perhaps doing reconstructions around implants. So it's a very tailored approach, and actually I regard some of my role as just utilising other consultant specialists who are most appropriate for your needs.
Oh, great. That sounds fantastic. And everyone on your team will be a consultant specialist in breast problems, is that right?
Yes, and the plastic surgeons come at it from a plastic surgical perspective. The oncologists are specialists in all the types of adjuvant treatments, or treatments such as radiotherapy or chemotherapy, and some of the drug therapy and hormone therapy. The pathologists are specialists in breast pathology, and breast surgeons, such as myself, are specialists in what we call surgical oncology, so the operations that are needed to deal effectively with a cancer and a tumour. Right,
so it's not just about the surgeon, it's about the whole team, really, isn't it?
I'm very reliant on my team, but they're well chosen, and we all work very well together.
Right. Well, I'm sure you do, and that's fantastic to hear that. So, Michael, if someone wanted to get in touch with you and your team, how would you advise them on how to do that in the best possible way?
I would suggest filling in the web form that the links are below the picture here. As I said earlier on, most of the time I'll arrange an appointment to see you, and then we can discuss things through. If I think it's, if in the box I think perhaps you need to start with a mammogram or just seeing one of our radiologists, I may refer you directly onto one of them. But if you fill in the information and say how we can get in touch, then we can take it.
Well, that's fantastic, Michael, and it's been really good to talk to you. Thanks for sharing your time with us.
Thank you very much.